So by way of an introduction, hello, I'm Sarah Harris. I'm the Physiotherapy Placements Coordinator here at the University of Winchester, and I'm delighted that so many of you are attending today. There will be time for questions at the end of the webinar, but by all means, if there's any questions that you'd like to ask during the course of the presentation, please just pop them in the chat box because we will be monitoring that during the course of the webinar. So to get started, I'm very pleased that we have 5 of our final year physiotherapy students joining us today to talk about their experience of non-traditional placements. Unfortunately, our 6th student was unable to join us this afternoon. However, we are very lucky that we also have their practice educators on the webinar today who will be saying a few words, giving us a bit of an insight into their experience of supporting a student in a non-traditional placement. So I'm very excited to hear their side of the placement as well. So finally, I just want to finish that, as I'm sure all of you, we are extremely open and proactive in exploring new and innovative ways of working, recognising this approach is important for increasing placement capacity and for producing resilient, resourceful and capable and competent physiotherapy students. And I have no doubt that our speakers today will demonstrate that and highlight the incredible learning potential to be had from approaching placements differently. So we only have an hour today, so I think I'm going to pass on to the first of our student speakers today, who is Sarah Wilcox. Sarah, off you go.
Hi there. Are you going to give me...
You should just be able to take control of the screen. Yep, so I'm just going to allow you access. Okay, should be good to go.
Right. Let's just see if it works. Oh no, it's not going through. I can't see the arrows for the actual screen. There we go. Right. Hi, everyone. Sorry about that. My name's Sarah, and I was lucky enough to undertake a physiotherapy in older persons mental health setting over at Gosport War Memorial. And this was an emergent placement for me. There was no physiotherapist in post and had no clinical therapist in post for a number of years. So it offered me a plethora of opportunities to explore both the physio facets of what we could provide for the OPMH, but also the non-physio management and also leadership side of things. So at a glance, hopefully this all works because the animation did before. I worked on both the functional and the organic mental health wards over at Gosport War Memorial. I was lucky enough to undertake the volunteered paid placement back in the summer as well. So I had a good 8 weeks on the organic dementia side, but also on the functional for my previous kind of official placement, for want of a better phrase. And these are the kind of things that I came across, and this list isn't exhaustive. And to be honest, this wasn't something I'd ever come across before. I have been lucky enough to not have any family members or friends suffer with this. So really, it was from a personal and professional point of view. This was brand new, a brand new area for me to kind of navigate, as well as pop in the physio element to it. However, it was probably one of the most beneficial placements I think I've completed so far. In terms of physiotherapy input here, you know, with regards to OPMH, there is an increased likelihood of physical health issues and an increased risk of comorbidities. So the initial question of where does physio fit in with OPMH, it's not a presentation about what happens, it's more of an emerging placement, I get this, but it was just really to give you a background of my understanding of the of this facet of physio and the questions I had going into it, like where do I fit in? So in terms of like our older person, when we approach this, you know, we have people who come into hospital, they're, you know, loss of productivity, their job, their ability to earn. So their decisions in life are going to maybe be slightly different to that of the to a person who can afford to make maybe a little bit more healthy decisions about what they do and lifestyle choices. And so when we look at it that way, actually, as a physiotherapist or a physiotherapy student, we're in a prime position to help with that in line with the actual physical physiotherapy or physical therapy provided on the ward. And so what I went in with is an idea of like interventions and management of the patients that were presented. And this was quite a little bit this graphic. But I used this as almost an idea of what the patients might present as. Oh, thanks, Sarah. And just to give you an idea and to try and understand that the people, not just the NHS numbers that were filling the ward. And it was very much a mix of the physical aspects, so everything we've learned on our course, along with the psychological, and really getting an idea of how to deal with people in these positions, to then actually put it together to understand from a holistic point of view the well-being of the person who was going to be discharged back out into the community, because that was obviously the gold standard. We wanted to return them, especially in these COVID times. So these are the kind of things that I went in with, trying to like multiple hat my approach to the patients. All right, there we go. So I was starting to think about physiotherapy in a bit more of a detail, and we've got, you know, from the patients that were presented on this secure ward that I worked on are much like any patients that I see in a stroke unit, in an orthopedic setting. You know, they have pre-existing musculoskeletal issues, you know, cardiorespiratory issues. They're the older population who present with other comorbidities, and these all have to be taken into consideration when treating the person, and not just their psychological diagnosis. Okay, and that was my feeling going into the placement, is this, like, it's been identified that the physio is required. We can play a key role, and it was more that mindset that I approached it. And being in that final year, I was lucky enough to have the experiences behind me to do so. So what is the emerging placement, you know, given like Gosport War Memorial and myself? Well, it's established the input of physio services. You know, they had me for 7 weeks. They could use me to trial assessments and things like that. They could use me as much as I could use them, if that makes sense. And it worked really, really well. We met a recognised need within the service for physio provision, and actually in a second, I'll say it again in a second, but there was a band 6 actually physio taken on about week 5 of my placement, and it was quite nice to be able to hand over some of the things that I'd either set up, established in place, and also get feedback on that. From a student perspective, it's provided me with the skills in promoting physio, banging the drum, waving the flag of physio. I took it as almost like a personal endeavour whilst on placement to do that. And again, it allows us to trial in a safe and supported way, kind of a physiotherapy service in that setting. From my point of view, I learned a hell of a lot in terms of teamwork. I have a background in teamwork and communication as a mature student. However, it's a very different beast when it comes to the NHS. So actually working with non-physiotherapy staff was a key part of my development throughout this placement. And also the clinical skills that I gained through direct patient contact. The fact that I didn't have a physiotherapy as an physiotherapist as an educator wasn't an issue. I had a long arm, which I'll go into the kind of the setup shortly, but it really didn't affect how I managed to experience or get that patient experience and that patient mileage through the placement. So my position was covering both the functional and organic mental health wards. Unfortunately, the first week I was there, we closed down the organic ward for refurbishment. lucky enough to work in a band 3 level for the VPP over the summer on the dementia side. So I had almost like a super placement, if that makes sense, 16 weeks of OPMH. We had occupational therapists, physiotechs, recovery workers in the therapy team, and worked very, very closely. There was a recent appointment of a band 6 physio, which was great, just to bat ideas off towards the end. But my educator was a band 6 occupational therapist, Yanni Melsom, and she was fantastic in reading what I needed from a professional and personal point of view. I was ready to try to go out and act more like that band 5 level, knowing that there was support behind me and knowing my limitations in being a student, of course. I then had a long arm supervision from a previous educator, Tom, down in the MSK. So if I did have any physio related questions, I knew there was a reach back to more support should I need it. And so what could we bring to the table as a student on an emerging placement? Well, you know, we're keen at the end of the day. We want to showcase what we've learned, what we've got to offer. We have an open mind. To be honest, with Winchester being at the forefront of an emerging course and kind of that those trailblazer kind of mentality, we could come in with open mind and with a questionable, you know, the ability to question why. We have fresh eyes and we have an enthusiasm. At the end of the day, in 5 months, we're going to be out there as band 5s. So we want to soak up as much as we can. So how did I go about approaching this emerging placement? I broke it down into 3 kind of sections, if you will. I didn't want to just jump in with 2 feet and start either changing things if I didn't know what or understand. So there's a bit of scoping and brainstorming, talking with the educators, talking with other members of staff, and really developing those working relationships, and banging that drum of physio. But there was an onus on me as a student. You know, you get out what you put in massively, to coin a cliche. So this is the kind of things that I undertook, and things that if you were having an emerging placement student come to join you, you could direct them in these kind of activities. I mean, again, the list isn't exhaustive and I probably haven't got everything on there, but it's all about empowering the student to go out and do. And then obviously the use of past experience. So I have I was 10 years in the Royal Air Force, so I'm not worried about standing up in front of people talking. So I can use that experience. My other qualifications, I'm also a mum of 2, and I'm a school governor. So those, I suppose, approaches to people, utilising people's skills, getting people on board, the teamwork, leadership, you name it. Younger students will come with a plethora of their past experience. They've been well-being members at university. They've had other responsibilities in terms of jobs, etc. So there's always something that they can use to adapt the emerging placement to suit those. And obviously the previous placements stood me in. I used them massively. The experience that I got there to really hone what I wanted to achieve on this emerging placement. So how did I do it? I'm just going to pop this list up. Oh, look, there we go. I've become too technological, made them dim afterwards. So we need to become fully absorbed. As a student, it's not just a case of being, it's the student. It's, you know, where's Sarah, the physio student, you know, and often quite, you know, you have to correct people, say, I'm not, you know, it's not Sarah the physio, it is Sarah the physio student, and that's no problem. But I was given a name, and I was fully integrated with the team, which was great. Working with staff, other staff, to assess patients to optimise their treatment. If a patient is too tired by 9:30 in the morning, and then let's get their physio completed in bed if they need to. If they can't do inner quad exercises when you go down to see them at 11:30, get there at 8 o'clock and head straight to the ward. Demonstrating the use of physio and assessment through a diverse range of patients. You know, we had patients who are in the midst of a psychological crisis, and sometimes a formal assessment is not the way to go. forwards. So being able to just try my hand at various different approaches. A lady didn't want to be assessed because she thought my notes would go towards her death certificate because she was convinced that the ward was melting patients. So it was really a right, what can I do to get this lady on board with what I want to see? And we used music. She liked rock and roll, so we were doing sit to stands to rock and roll music. She followed me, but she was very keen that she was just doing her own thing. But so it was just taking on board different aspects of a person and seeing them as a whole, as opposed to that patient number and the diagnosis that that they're faced with. But I also managed to get some like respiratory assessments, chest physio, because these patients are carrying comorbidities through. They might come through from, they might have had a previous stroke, they might have had a neck of femur fracture. They carry all these other issues that we need to deal with that actually may then affect their mental health as well. So it's seeing that person as a whole. I keep on harking back to it, but I don't think I can emphasize it enough. Exercise. They do a daily exercise class. You know, we need to conform to government recommendations in terms of exercise and the intensity. We have patients that are 66, you know, all the way up to 90 odd and above. But again, everybody's different. You're going to have a 90-year-old that probably is going to be fitter than a 66-year-old that you've got. So actually the intensity that you provide needs to be specific for that patient. So having an understanding of the guidelines behind what you're doing was essential. Having a look at falls and frailty, you know, they are in that either age bracket and also within the I suppose the demographic for being increased falls risk and coming into that frailty. And if they weren't frail prior to coming in, automatically, well, in my mind, it was actually we need to start from the beginning. They might have been completely active before, however, they've come into a new environment, new medication, change of medication, become more likely to fall, and we have to deal with that or educate. So whilst I was there, we could also do some scoping for new equipment and classes, utilising that kind of openness, or so that keenness to improve the service. So whilst we were there, I scoped or wrote a proposal for a SARA steady, which we didn't have, which meant that I could mobilise a patient and potentially get her discharged in a more timely manner. If she was going to placement, there were probably more options for her, or if she was going home, it might be something else that her son or daughter could use with her, as opposed to being hoist bound. And then there was also looking at other divisions over in Southampton with what they were doing. So there was a Tai Chi class they provide. So that was I also wrote the proposal for that. So we managed to secure funding for both, and we just actually the equipment should be there and the class should be starting hopefully after COVID, or once COVID limitations allow. And it's the development of the student pathway. At Gosport Walmerall, it's not going to be an emerging placement anymore because it's established, which is a really nice feeling. So it was really having a look at what I could leave as a kind of a legacy for the next student, and also make life a little bit easier for the educator and the supporting staff that were there. I've already alluded to the NHS and the NICE guidelines provided me with the basis in which I could develop my assessment, my treatment, and my goals in line with the patients, what they wanted as well. Quite a lot of time, the first couple of weeks of someone being admitted, they're not suitable for treatment. I say that with kind of, you know, quotation mark signs, but using what you have to hand and what that patient will do with you. They might walk with you, but they don't want to do a specific class, but they might walk and talk. They might do sit to stands with a rock and roll kind of music in the background, because that's what they like doing, and they don't see it as a medical. Well, in-service training, we've done in-service training throughout my placements every week, or provided kind of input for that, and that was something that I felt that I could give back to the ward and the therapy team, offering something external in terms of you know, parts of the brain, what they do, why our patients would present like they do if they've had if they're having a certain crisis or a certain medication, and it was just kind of linking everything back. And you know, if you want to really know your subject, then you need to teach it. And it was a great way of for me to kind of consolidate learning. Right. For some reason, the PowerPoint. Can everyone still hear me? Because the PowerPoint won't go on. That's okay. Well, the holistic approach to ensure the patient is treated as a whole. At the end of the day, they're not an NHS number. They may come with a psychological diagnosis, and that be the reason for their admission, but they come with a story and their own fears, their own goals, their own background, and it's really getting to grips with who you've got, the body that's in front of you, also the grey matter that supports it, and both are inextricably linked. And as a physio student, I have managed to learn how to adapt my skills to suit that person in front of me, and two people with a similar diagnosis will not be treated or assessed the same. It has turned what I have learnt up on its head, but I've managed. It's been a path of you know, trial and error, whilst remaining supported. And the emerging placement, I think, as a whole, is an extremely useful tool for the right person in the right location. From educators and those I worked with, it was very much a two-way street. And so that was my experience at Gosport War Memorial. If you've got any questions, please ask.
Thank you, Sarah. I think we'll just very quickly see if Adrienne, your supervisor, has any words to say from her perspective. Adrienne, you on the call?
Hello, I am. Can you hear me?
Yes.
Yes, lovely. Yeah, I've jotted down a few of my reflections on supporting Sarah with us on emerging placement. So I don't want to repeat too much, but to be honest, I mean, as Sarah said, we knew her before she started with us officially, which definitely helped. And my biggest concern is the fact that she's a physio student and I'm an OT, and you know, we are clearly not the same profession. And I was concerned that, you know, would I be able to support her enough, and just would that work? But actually, it worked very well. And having the long arm supervisor was really useful, was really reassuring to have that there in case we needed it, if we did have a sort of a clinical crisis. Luckily we didn't, but it was nice to know that Tom was there if we needed him. Sarah said that in this setting, she, you know, when she didn't require any very specialist, detailed, complex, you know, very specific, I would say physio skills, I don't mean, but in terms of she was able to use all her opportunity for previous experiences and really consolidate all of those clinical skills that she already had. But I do feel it is important within an emerging placement that those, to have a student who has got a range of skills and is already competent to use those, you know, that was really important, because I think if I had then had a student who was requiring support to I don't know, complete parts of an assessment, you know, I would have had to have gone to that long-arm supervisor to have overseen that and make sure that that was moving along as it should have done. I would say that there was definitely lots of opportunity for just learning about working in mental health and with people who are in psychological crises and people who aren't motivated and who have all sorts of thought disorders and lots of anxieties and lots of issues like that, which was a fantastic opportunity to be able to offer, as well as all those generic skills, those management skills, service development opportunities. You know, we all know, and working within any job, that there is more to our work than just hand work. So to be able to offer that was fantastic. My approach that I tried very much as the supervisor, I very much saw my role, it wasn't to stifle Sarah or to make her sort of think, well, this is what we do and this is what I'm expecting sort of from you. I very much try to be quite hands off and sit back and just observe from a distance, keep an eye on what was going on, but really let Sarah take the lead with her placement and where she wanted to take it. So let her develop her own ideas, her plans, problem solve. But overall, it was very important, and we did have it throughout, is that we had absolute trust and confidence in the student. I think that is really important, because to let your student go off and work independently with people who are very poorly and have got a lot going on in their life, you really needed to just trust that student. And also have the assurance that the student would come and give good feedback, ask questions, seek just want to check what I'm doing is okay, and have that two-way conversation, just so that we were fully in the picture. So good communication and a positive working relationship was absolutely key. But overall, it was a really positive experience, and it wasn't a problem at all that I'm an OT and Sarah was a physio, because our patient group need a very holistic approach, so it worked very, very well.
Thank you.
Okay.
Thank you ever so much. Okay. Sarah, can you give me presenter access again, please?
I've given it back to you a little while ago, Sarah.
Oh, yeah, you have. Thank you. Okay, so if I now hand over to Emma.
Hello, everybody. Can you hear me okay?
Yeah, perfect, Emma. Thank you.
Yeah.
Lovely. How do I control my slides?
If you just request access from me, and then I just have to approve that access, and then away you go.
I'm sorry. I'm really sorry. How do I do that?
That's all right. It should be at the top of your screen, Emma. Don't worry, if you can't find it, that's okay.
No.
I can control the slides for you, no problem.
Yeah,
Just,
sorry, I'm having.
That's all right.
Okay. So hi everybody, my name's Emma, and I did my placement in a forensic mental health setting. It was a physiotherapy emerging role. So in the hospital that I worked at, there hadn't been a physio permanent post, or prior to myself, there was a private physio that would come in for a morning every fortnight, but that was kind of it prior to me. I was directly supervised by the band 6 OT Chris, and then I had a long arm supervisor who I believe was a band 6, and she worked MSK community. Next slide, please. So basically, I learnt how mental health services work in a medium and low secure. So they are patients who had committed a crime and then been put into hospital as they had committed a crime due to their mental health issues. So I saw a lot of schizophrenia, a lot of personality disorders, and bipolar. And I visited both the medium secure, so Ravenswood Hospital, and the low secure, Southfields. At both kind of sites, I looked at establishing physiotherapy needs within the hospitals and where I could help out. I carried out one-on-one sessions with patients, although not as many as I originally thought, and it was predominantly with new admissions who I would do a basic power, mobility and range of movement assessment on to kind of assess whether they had any needs, and then later on you can see whether a patient has declined from their baseline basically. A lot on health promotion and campaigns within the site, and promoting kind of the importance of movement and what it can mean for the patients. And I observed a lot of occupational therapy assessments as well, and I tried my hand in them. So for example, like mocker assessments, I gave a good go. And those were kind of the main things in a nutshell that I did. Okay, expectation versus reality. So I thought I going in, and I didn't really know what to expect, to be honest, but I thought I'd be going in, I'd be doing lots of physiotherapy assessments, doing all sorts of MSK, neuro, respiratory. I thought I'd be going in and booking in my diary, kind of like an MSK outpatient, if you like, and treating like a wide range of conditions. I had the expectation, which was correct, that I'd be undertaking group exercise classes with the wards to help patients move more. And as always, as a physiotherapy role, we're here to educate people. So that's what I was expected to do. And I very quickly found that all of my ideas, some of them didn't work. And that was kind of for a plethora of reasons, really. Mostly because they're so acutely unwell, they find it really hard to engage. So trying to have a conversation with them about why they need to do certain things, or exercise plans, home exercise plans, that sort of thing, at times it was a real struggle. So it was more of kind of the just engagement and the implementation of ideas of change. So to kind of create their autonomy and get them to think of wanting the change in themselves. It was kind of me being there to implement that for them. There was, as I said, minimal one-on-one sessions. A lot of my role was feeding back at the MDT on sessions that I'd had, what I thought, and just basic things like cutting toenails and things that you wouldn't necessarily think of, but with a physiotherapy eyes, I got to see those. I'd worked with some patients on nutrition and meal prep, and we looked at keeping a food diary and the more nutritious options that they could choose from when they were preparing their meals. Did group sessions. I did group sessions with 3 of the 4 wards there. That included, we did yoga, we did circuits classes, table tennis, curling, bowling. So we did a number of different sessions. Promoting mobility and health on the wards, and I did this through, I made some posters and some leaflets and I circulated them around to the wards to be put up, and I did work with some one-on-one patients on some basic mobility as well. And education, I think you can say a lot about it to anybody who would listen, really, but I tried to teach everybody something while I was there. Next slide, please. This presentation is a little bit shorter than Sarah's, but the key learning points that I took from this placement was it's okay to have lots of different ideas, and it's also okay for them not to go right all the time. It's okay for things to not work. Think creatively, thinking outside the box, working as part of an MDT in any trust, any role that you work in, it's always important to work as part of an MDT, and that was apparent here as well. The changing of communication styles. So I'd find that the patients, some of them were at different levels on their recovery. So I could have a conversation like I would be having now with a patient, and or some of them would be at a much acuter level. So you'd have to amend the words you use in your communication style. I felt very safe the whole time I was there, but it is having it at the back of your mind to be alert. Although they are patients who are unwell, they also did commit a crime. So it's just having that awareness. We do wear alarms and we do have to have keys, and there is a reason for that. Be open to change as a physio. I think I touched on this, but don't get too disheartened if ideas don't work, and it's being adaptable. And as I've put in the next bullet point, utilising skills in the toolbox. If one idea doesn't work, okay, great, what can I use for my next idea? Or if that did work, great, what worked about it, what can I utilise and harness and use in the future? And then celebrate the small wins. There were some little things. So I found that a lot of the patients would come off the ward to do activities such as like cooking or sports, and they would wear socks and sliders, which is obviously really comfortable, but not very practical, especially if you're going to be playing sports and kicking a ball or running around. So I just implemented kind of the promotional and making sure that you've got appropriate footwear on for the task you're about to undertake. And one of my patients, I remember just trying to engage with him constantly, trying to get him to put his trainers on, and he would kick back a little bit and be like, why am I doing this? And by the end of the placement, he would put his trainers on unprompted, ready to leave the unit, the ward, to go do his activity. And for me, that was a massive win. although it doesn't seem like a big thing, it seems like a small thing. It was a really big win. Thank you. I'm just reading the chats now. Okay, no questions there. So yeah, and it's just kind of about recognizing that. And then my 3 top tips to get stuck in, like, just get onto the wards, meet everybody, meet the patients, meet the staff, and just make sure that everybody knows who you are, get your presence known. Remember that they are patients and people first. I didn't struggle with this, but I can imagine it would be easy to fall into the trap of going, this patient has committed this crime, X, Y, and Z, so therefore they're a criminal, or this person has schizophrenia, so therefore I must treat them like a schizophrenic, when actually they are patients, they are people. We're trying to get them back to a level where they can integrate back into society as an individual, and that's really at the centre of everything that we're doing there at Ravenswood. And then don't be afraid to try new things, and just get stuck in, and if it doesn't work, don't dwell on it and move on to the next thing. And that's it. It was short and sweet.
Thank you, Emma. No, that's brilliant. And I wonder if, Chris, you're on the call and you're able to give your perspective in supporting Emma on that placement.
Yeah, very much so. Thank you. It was a really valuable experience for us here at Ravenswood. I mentioned to Emma a few times through the placement. She brought her physiotherapy lens, which is something we haven't had. I mean, Emma really stepped into the breach and, did new stuff for us. And we're a poorer service now that we haven't got that. We are pursuing it actively to try and get some physiotherapy role here. But it just really raised questions about our practice. She was able to highlight some of the things that maybe we have been a bit blind to at times, and it just gave us an opportunity to develop. So for myself personally, I'd reiterate what Adrienne said, really. The long arm supervisor was really helpful in terms of knowing that there was somebody else there with physiotherapy professional experience. Obviously, I'm an occupational therapist, a bit like Adrienne. It helps that having a competent, confident student, and Emma was excellent at everything she did, really, in terms of her interactions with patients and the treatment she offered them. And it was good support from Winchester as well. If anybody's thinking about offering these kind of placements, I was really impressed with the support I had from Winchester in terms of the preparation beforehand and the support throughout the placement as well, in terms of regular checking in just to see how it's going. So it was a really good experience for me and for the service.
Thank you, Chris.
Okay, thank you.
Okay, I'm quite conscious of the time, hopefully, and we may run slightly over the hour. I hope that's okay with some of you, because we've still got 3 fantastic presentations to go. Okay, Amy, off you go.
Hi, good afternoon. My name's Amy. I was on a purely virtual placement with Connect Health. So hopefully...
Are you able to control the slides okay, Amy?
Yeah, I can move my mouse around, but I can't. Oh, there we go. Okay, fine. So this is just an overview of what I'm going to be doing. It's similar to Emma's presentation. So firstly, it was a purely virtual placement. So I worked from my bedroom in my house every day from 8 till 4. Well, it varied, but for 8 hours a day, which was different. I'd never done that before, and I think I might have been the only person that was on a purely virtual placement. I know there were some partial placements that were both practical and virtual. So Connect Health, they're the biggest provider of MSK for the NHS. I was able to work with people all over the country, so I wasn't really sure what I was going to go into, but I ended up working with people in Newcastle. I worked with people in several locations in London. It was very varied because obviously it was all virtual, so whatever clinic I went into, it could have been anywhere. I made my own timetable every day to fit around my schedule. I also completed 2 presentations while I was on the placement, one case study and one what was called a clinical coffee. So that's just something that, like an article or a topic area. I chose acupuncture that we found interesting or we didn't know much about or we wanted to learn more about. And then we presented it to our peers. So it was a group of 5 or 6 other students that were on placement at the same time. And presented it to them and got feedback from them. And I also did some Facebook Live classes as well. So expectations and reality. There we go. So I thought I might be stuck to my desk and laptop all day. I haven't been on a virtual placement before, so the only idea that I could think of was working from my computer all day. But I was actually, like I said earlier, able to create my own schedule and work it around what I wanted to achieve that day. So if I had an appointment or something like that, I could like slot out time and do the evening. Or if I wanted to go for a run in the morning, I could do that and work in the library in the evenings. Or even if I worked a full day and then did library work, the next day I would take some of my hours off. So it was really flexible like that. And I'm sure Matt won't mind me saying, but when we first started, he said, if it's a really sunny day and you just want to go outside and meet your friends or go to the beach or something, then do that, but do your hours on the weekend and do research and your hours in your timetable. So it was really flexible, and I found that really useful. I also thought that I would be on the phone for most of the day and be like assigned patients and given a workload. But what actually ended up happening was I could pick and choose which clinics I would sit in on. So the way it worked was I would go onto Teams and I would have a login for Connect Health. And then I would be able to add different clinics to my calendar. So there might be a CATS clinic, which was like a triaging service that Connect Health offered. And then there would be, or just an MSK clinic, or rheumatology, or a pain clinic, or hand therapy. I could pick and choose whose I wanted to sit in on that day, and I would get used to how different clinicians worked and their different styles, and that was really interesting. I also thought I would be the only student on that placement. I didn't know of anyone else at Winchester, so I just presumed it was just me. But there was actually a huge cohort of students from all over the country. There were people from MMU in Manchester, there were people from Leeds, there were people from Kiel, there were people from Teesside, there were people from all over the country. I think I was in a cohort of nearly 30 students, but I might be wrong. I'm sure Matt has the proper numbers on that. But yeah, there were loads of us, and it was actually really interesting because they would be at different stages of their learning because we're not following the same modules. So that was really nice. And it wasn't just third year students, there were second year students as well, and some were master's students and some were second year master's students and first year master's students. So it was a huge variety of people that I worked with. I thought maybe that I would only be doing subjective assessments. I found it difficult to imagine MSK in this COVID climate. You know, I found it really hard to picture how I would do an objective assessment or what that would even look like. But I actually got to listen in on quite a lot of subjective assessments, but often they would do an objective assessment over the phone, and that was really strange to hear, but very interesting because you have to be quite short and snappy with what your instructions are for the patient, and it also massively depends on the patient's health literacy and whether they understand what you're trying to say. I also thought that I would be alone for a lot of the day because it is just me on my computer. But yeah, as I said earlier, I worked with a lot of people, and it actually felt like I was meeting lots of different people throughout the whole day. And yeah, like I said, I did create and present my own Facebook Live classes as well as doing some subjective assessments. I mostly sat in and listened on assessments rather than did them myself. So I didn't have a lot of patient interaction, but I think that's just because of the type of placement that it is. It's hard to schedule in a student to undertake some of the subjective assessments because of how busy the clinics are and things like that. But I still felt it was very beneficial, and I feel like I've got quite a good understanding of how a subjective assessment or even objective assessment over the phone can be done. The key learning points I have, how to use Teams was a big one. I think I started because we hadn't done many online lectures yet, and I don't think we'd used Teams for them. It was like a whole new world for me. So I've learned how to make meetings on Teams and schedule meetings with Matt, or I scheduled meetings for I'd join meetings and clinics and add them to my calendar, and how I arranged that and everything like that, and how Outlook was connected to Teams. It was all very confusing to start with, but it was really good. And then I've got how the MSK world might be heading in this new COVID-19 environment. I feel very privileged to have seen what that looks like, because I feel like I'm sure there's a lot of people in practice currently that aren't in MSK that can't even imagine how you would go about that. And there are face-to-face appointments. Obviously, we didn't see those, but there's a lot fewer of them, and I feel like it could be heading in the direction of, you know, doing the subjective over the phone, or triaging them further if it's got a bit lost or something like that. But the face-to-face could be slightly more limited now in this new environment and post-COVID going forward. I learned how to manage my time effectively. That was different for me because I've usually on a practical placement, they'll tell you where you're going, or they'll assign you a ward, and you'll have a list of patients that you've got to see that day, and that's how you would plan your day out. But for me, it was, okay, I'd like to do clinics in the morning, then I'll write my notes up, I've got an hour for lunch, and in the afternoon I'll do some research. And that's usually how my day went, because that's what I preferred. I can't speak for other students. I don't know how they set out their days, but that's, yeah, what I chose to do in the end. Like I said earlier, how to undertake an objective assessment over the phone, and how to undertake a class over Facebook Live. So one of the opportunities that we had was by week 2, we had to give in a script and an example of what we were doing for our Facebook Live class. So I chose to do over 65 post-lockdown fitness, and I did 3 classes, one at beginner, one at intermediate, and one at advanced level, and I did it in my lounge. And I turned my webcam on and put it on their Facebook Live, and we had a login to Connect Health actual Facebook Live, and they're all there and you can all see them. There's loads of different students who have done loads of different things. Some did frozen shoulder, there was a lot of carpal tunnel, non-specific low back pain. There's a whole host of things, but yeah, I chose to do over 65 post-lockdown fitness because I thought it's quite relevant at the moment. And my top 3 tips would be: make sure you take breaks from your desk to eat lunch and stretch your legs. I think this was something that I learned a couple of weeks in. It makes a huge change, because obviously your bedroom is usually, or your house when you come home from placement, is usually where you relax and unwind at the end of the day. So trying to change that was interesting, and making sure that I got out the house, because otherwise you would find yourself sort of sat at your desk and you haven't left the house for a couple of days, you know, because you haven't needed to, and especially when we went into lockdown as well, there was no need for us to. But yeah, that was really important, I think. Make a timetable and try your best to stick to it. This was some advice that I was given by a student mentor while I was on the placement. We all were assigned another student from the cohort that came in behind us. So someone got me and then I got someone else, which was really nice as well, because you could ask a lot of questions about what you were going to expect, because none of us had any idea. But yeah, one of the pieces of advice that my student mentor gave me was that to make a timetable and try my best to stick to it, because it just makes allocating time in your day a lot easier. And finally, I would say, especially with Connect Health, utilize every opportunity and every platform. I think if I were to do it again, I would use their Facebook Workplace a lot more. There's a whole bunch of pages, and clinicians and students post articles and nice guidelines and loads of different things, and there's a whole host of information, and I feel I probably could have utilised that a bit more. But yeah, if I were to do it again, I would definitely use more of their platforms. Yeah, I think that's it.
Thank you, Amy. And Matthew, were you on the call as well to say a few words about supporting Amy completely remotely during that placement?
I am. I think Amy's summed it up really well, because I think on the face of it, if you look at it, you think it's a very passive placement, that you're sort of just shadowing clinics and dipping in stuff in your bedroom. And I think that's been the surprise to all of us. Amy was our 200th student and my 3rd virtual student over the last 6 months. But that actually, the students taking ownership of the placement gives them such a wealth of opportunity to explore what they want to explore and develop their own learning, that it's been great. And Amy was a really great example of that. I think I spent probably 20 minutes most weeks with Amy total, and we exchanged a few emails and I give her some feedback on what she was doing, but she owned her learning. And I think that's a huge learning for us, is that I think we probably, and listening to the other presentations, underestimate students and I don't know what the word is, under challenge them rather than actually giving them a lot more of these transferable skills instead of just spoon feeding them passive information and clinic lists. So yeah, great work all.
Thank you. Okay, I'm hoping my screen is going to change over. Amy, have you stopped control?
Hi, yeah, I have stopped it. I'm not sure though.
I think we've got a bit of a delay. Oh, here we go. So Dan, you're up next.
Hi there, my name's Dan. I've got control now. So my placement was a split placement with Health Education England and the Royal Hampshire County Hospital, and specifically with the orthopaedic team at Winchester Hospital.
Sometimes I think it takes a few minutes to take effect.
Yeah. There we go. Perfect. So it's just an overview of the learning. So at Winchester Hospital, I saw a range of different elective surgical patients. So it was only an elective ward. I had a previous placement on orthopedics at QA in Portsmouth, but that was elective and trauma. So this was just elective. So I was able to sort of further develop my knowledge and skills around the elective surgeries, so total knees, total hip surgeries, to ACLs, ACL reconstructions, some shoulder surgeries. So it's really good to see those. I carried out pre and post surgical assessments, worked closely with the orthopedic MDT. So it was really good to work with OTs, just everyone in the team really, whether it was therapy techs. I was able to got the opportunity to see 2 elective surgeries. So I saw a hip replacement and a knee replacement, which was pretty cool, I thought. Yeah, definitely had a bit more sympathy for the patients after seeing those. And then because of the pandemic, I was then with a even further reduced service. We were moved to the medicine wards. And so with the whole of the orthopedic team, we went to medicine, which was a complete change, but it was actually really nice that everyone was so flexible and happy for us to just crack on seeing lots of different types of patients. So the change from elective to medicine patients is quite different, really. But this was, it was a really good experience. I hadn't been on a sort of medical placement before, so I got sort of 3 placements within one, really. So it was a really good opportunity. My knowledge, the breadth of knowledge I learned was probably the most out of all placements I've had so far. And I was able to present. I did a presentation to the team I was on hip precautions. And so to begin with, because it was a split placement, I was in 2 days clinical at the hospital, and then 3 days with virtually with Health Education England. And so what I did with Health Education England, I had teachings. So at the beginning, just on basically what Health Education England did, the range of things that was going on. So sat in meetings about the different projects that were going on within Health Education England. So I was able to get like an understanding of what's going on. I had my educator was Beverly Harden, who's a very busy woman. So she was amazing, and still took so much time out of her day to make sure we knew what was going on in different meetings. So we'd be in a meeting at 8:30 till sometimes 10:30. It could go on till lunch, and then be in the afternoon, be in a meeting about something completely different, and it was a massive it was a whirlwind, but it was really interesting to see what's going on in Health Education England and see the different sorts of leadership skills and careers outside of clinical setting. I helped with one of the main things I did was help with a research project where we looked into the motives and barriers to becoming an AHP student, where I helped with the sort of literature review and communication strategy, and even got the amazing opportunity to present to the professional bodies about this research project. So I didn't really know what to expect from my virtual placement because I'd never had one. I already had a sort of a basic understanding of elective orthopedics, but didn't know what to happen because of the pandemic. I didn't know whether this would shut down, what would happen if there was to be no orthopedics. So I was unsure in that aspect. I had no idea, like I said, no idea what was going to happen with virtual placement. I had no idea whether any of it would be clinical. So in that sense, I went into it with slightly negative expectations. So I thought, how is this going to make me a better physio? So I was like, I'm not getting any clinical time apart from my when I was in the hospital. So I was a bit worried going into this. But in reality, I further expanded my knowledge in the orthopedic setting. So even though I had been on orthopedics, I was still able to improve my clinical skills, working with my communication skills to the medicine setting. So everyone was super flexible. I was working with a range of different people, and they were always happy to, even during the pandemic where everyone's a bit stressed and there's people getting tests and having to be off from work. Everyone was really flexible and always happy to help to do some teaching. And then within Health Education England, I saw a range of different leadership techniques. My communication skills, I feel like they improved over Teams. In the meetings, I felt like I was being heard. I was with another student from my cohort, and we both felt like we were asked lots of questions. So lots of the projects are aimed at sort of future workers. So it was really, they were asking our point of view, what do you think would, from our point of view? So it was really actually interesting to be asked those sorts of questions. We had to be creative in our research project. So how are we going to get this project out? We're doing a questionnaire. And we piloted it at the physio students at our university. So it's really interesting. And how are we going to get this out to as many students as possible? And it was really interesting to see how just ideas progress into projects. So you see the projects at the beginning and then how it progressed, really. My key learning points, well, I learned sort of from a clinical point of view, sort of assessments and treatment techniques. Like they massively sort of progressed. So not just making it sort of basic, making it very individual and specific to the patient. I learned a lot of different leadership techniques and other people leading meetings, workshops. It's really interesting to see how they are led and how different communication techniques are used. I was able to see careers outside the clinical setting, which was something I had no idea really about from just having placements in a hospital setting. It was really quite interesting to see people that had careers as OTs, as physios, as midwives, and how they're now sort of in the sort of setting that they're in now with Health Education England, and just working in a pandemic. So like I said, everyone was really flexible. Beverly was happy for us to, during the middle of our placement, to then start doing we had a couple of weeks where we did 4 days clinical to make sure that we could see patients sort of journey from when they come into hospital to seeing them to sort of discharge on an elective orthopedic setting. And when we had to say get tested and weren't allowed to be in the hospital, I was able to then just be with health education and virtually at home. And then my top tips would be go into virtual placements open-minded, because I had the opportunity to do things that I never thought I would do going into like sort of a physio placement. You can always learn. So even though I had like a orthopedic placement, I still learned so much, and that really helped with going onto a medicine wards as well, and just to get stuck in really. You, like Sarah said earlier on, you get what you put in, you get out. So yeah, that's sort of my experience with a split placement.
Thanks, Dan. If you could just move to the next slide. Lovely. And then give access back over.
Should have done that. No.
So unfortunately, able to attend today. So we're straight on to Andreas.
Hi everyone, I'm Andreas, and yeah, like I said, I'll try to keep this as brief as possible, because I think obviously we've gone over time, so I'll try to be quick. Can I control it?
You should be able to. Can I just also ask if everyone can put their cameras on mute, because I can hear some background noise. So Andreas, have you requested control?
Oh yeah.
Brilliant, you should be good to go.
Thanks.
There is just a slight lag.
Cool. Yeah, so I had a split. So I was 3 days clinical and then 2 days non-clinical on a project. And that was for a Dorset-wide strategy for digital. So a really good opportunity for me. And then clinically, I was on paediatrics. So working with children, mainly neuromuscular conditions, CP, muscular dystrophy, and things like that. And yeah, it lasted 7 weeks. I had a practice educator for each, so yeah, anything that I needed, they were in constant communication, and yeah, I mean, they were in communication with each other and how I was getting on and things like that. So I had really good support from each. My key learning points. So I felt like my organisation level had to sort of step up from like a classic placement, because I had 2 things going on. So just basic things, really making sure I was writing loads of things down. I'm from sort of history, I'm not the best note taker, so I had to step up doing things like that. And then again, just using different platforms and setting Teams meetings, things like that. Yeah, and a whole new different communication level. So especially with the children, it was my first exposure to peds. So that's obviously took some getting used to, but even though it's obviously a short period I started to see some development there. And then digitally as well, like again, just something completely different to what I'd been used to. But yeah, that was a big learning point. And then again, the importance of digital. So obviously a lot of changes going on at the moment, and what's going on in the world, it really brought home that. And I was able to speak to loads of different people through engagement events, and how things, like I say, how things are changing and how professionals are having to work now. And then yeah, so tips for students going into the same area. So like every call I was on, people had their cameras on and sort of engaging for everything like that. And I think some of the feedback we had on the engagement events was from professionals saying like they're trying to obviously find different ways of working, provide good ways of service to patients, and trying to engage patients with digital platforms. So obviously if they're not willing to engage, and I think points like they had people are happy to FaceTime family, friends and things like that, but they're not happy to engage through different platforms of treatment. So things like that. Yeah, and I just found it's like natural to me. Like I say, I speak to my parents every night on FaceTime, my friends all the time, and so I think like I like social interaction. So anytime I can get on and speak to people and put my camera on, I don't mind it at all. And just embracing the new way of working. So everyone's having to change at the moment. So there's no good sulking for us. Like we're having to change. And I saw this placement as an opportunity to do that. Like as soon as there was the opportunity to do this sort of placement. I contacted Sophie and I said, like, I want to do it because I just saw it as an opportunity in the way that I could get practice before I qualify, to get a head start, really. And then lastly, just being more proactive. So it's not your classic like 8 to 4. I think clinically, like, you feel it a little bit more, say when a patient cancels and things like that, and it's more damaging because you're not in from 8 to 4 every single day. So every time that you can spend clinically with people is precious. So if something like that happen, how can I sort of react to that? And then I think speaking to other staff, is there something, can maybe we practice on each other and things like that? But yeah, just being as proactive as possible, because obviously I was at home for some of it, and again, like, I've not got great history of being at home and sort of like staying on task all the times, but finding ways and methods that me and trying to change for the best. Yeah. Yeah, that's it. Yeah.
Thank you, Andreas.
I think Lucy was on the call, but I'm not sure if Katrina's still on.
Yes, so we've run slightly over time, but if Katrina or Lucy are still on the call and you're prepared to say a few words, that'd be great.
Yes, it is Katrina Kennedy. So I'm the interim head of therapies at Poole Hospital, and it was an absolute pleasure to have Andreas with me for 7 weeks. And I think you mustn't underestimate the value of a sort of leadership project. So for me, he really gave a unique sort of lens of what it's like from a student's perspective. And I would really encourage others who are in leadership roles to have students on placements. The benefit for him was that he absolutely had the opportunity to network with Wessex Academic Health Science Network, with the integrated care system. He was on calls with the Dorset CCG, so really strategic thinking. And really encouraging others to engage in the project. His leadership skills were significant by the end, and just to see as well how he managed to use transferable skills in terms of communication, his organisation, which he's already alluded to, but also prioritisation. And I've now got a AHP digital strategy, which I would never have had if it wasn't for the support that I gained from having Andreas on placement. So a big thank you to him. And just if you're on this webinar or listening to it and you're in a leadership role, this really is a great opportunity for you and a student to look at a project with a very different lens. So thank you.
Thank you, Katrina. Lucy, are you still on the call?
No, she's had to go. She did populate some thoughts in the chat box. But Steve Sampson is here, and he also had a split placement with me doing another project. So it might be worth just having his insight for a couple of minutes.
Absolutely. If you're happy to speak, Stephen. Sorry, Nathan wasn't able to attend today, but yeah, if you could give your perspective, that'd be fantastic.
Yes, I was waiting for Nathan to do his, but I know Andreas as well from a previous placement.
Hi, Steve.
Hi, Andreas.
Hi.
I like having the camera on. I think with this new virtual image age, it's still nice to see people's faces, so don't be scared to put cameras on. I think with the way things are going, we are going more virtual. When I had a placement with Nathan, he got used to virtual patients, but we also still see a lot of face-to-face patients. Patients like having calls for subjective, and some can manage quite well having these virtual things. Some need to still come in and have that one-to-one approach. And I think that opened up quite nicely with things that Andreas is doing digitally, with Nathan doing a project and doing musculoskeletal physio. I think with a lot of the students that I've talked so far, one thing that's come across is that they're quite mature students. They've had different things they've done in their lives. They've come with some management skills. I think some students may struggle a bit with this approach and the time management issues of it. But the ones I've had have been brilliant. And with Nathan, he came with his sort of feet running. He came straight into quite a busy clinic. I actually got him looking after some other students that I had that turned up at the same time. They did a lot of peer support. I know Andreas and a lot of the other students have got and made a peer group, which Katrina got them to do, which involved training and support. So I think the thing I'd really say about it is good for management, it's good for organisation, it's good for flexibility. I just think we just need to bear in mind those ones that might struggle a bit with this and that still need those kind of hand-on training sessions and being able to cope with managing their own time. That's me.
Thank you, that's brilliant. Because I'm still sharing my screen, Sophie, would you mind facilitating any questions that we've got?
Yeah, of course. We haven't really had many questions, to be honest, Sarah. It's more really positive comments about the presentations, about the kind of the innovation and the kind of lateral thinking around placements. There aren't any direct questions, so if anyone has any questions, do you want to either pop them in the chat or come on camera and ask, or any comments at all? Lots of people are asking if we can share the recording and the slides afterwards, which I know is part of the plan anyway, so that's fine. I think everyone is stunned into silence and they've all gone away to think about how they can set up these placements.
That's brilliant. Thank you, Sophie. Well, thank you all for being here today. Thank you to all the presenters and the educators for contributing your thoughts as well. As Sophie said, we will be sharing this recording and the slides after this webinar, so you can look back on those. So yeah, that's it for today. Thank you, guys.